Hi, ma'am.
Hello.
Yeah, hi. Hi, everyone. We have our Dr. Afrose Fathima here. She's a MBBS MS Obstetrics and Gynaecology, and she's having 16 years of experience overall. And as a gynecologist in Mahidipatnam, Hyderabad, and has an experience of 16 years in this field. And good to see you, ma'am. Please.
Can we get started?
Yes, ma'am.
Okay. Today we are going to have a very brief talk about something about infertility. I thought uh, it's a very vast subject in itself, actually, and there's no need to go into so many technicalities. But what I thought was some awareness should be aware. We should be aware with what causes infertility, what are our lifestyle. The changes in our lifestyle which is causing the increasing trend of infertility. Now we are seeing there was very less percentage of infertility beforehand. Before many years ago, almost no one was now the percentage of infertility has increased to such an extent that almost 3 out of 5 people are here at the hospital because they are not able to conceive. So many lifestyle modifications happen, small, they're very small things which are, if they are taken care of, we will not even need a doctor actually. So what exactly is infertility? So I just wanted to have some general awareness. So infertility is the failure of a couple to conceive within the first year of unprotected and regular intercourse. So if you are young, if you are less than 35-year-old, and if your marital life is more than 1 year and you are not able to conceive naturally, that means it is time to see a doctor, because 80% of the couples conceive within 1 year. And the ideal age of conception for a female is between 20 to 35, and for a male, it should be less than 50 years.
Oh.
Can I have the next slide? So, what are the usual causes of infertility in males? So, as you can see, 50% of infertility is because of disorders of spermatogenesis, 30% because of obstruction of the efferent ducts, 15% are the disorders of sperm motility, sexual dysfunction, and unexplained is 15%. Next slide. Now, what are the actual causes? So, whenever you are seeing overheating of the testicles, you see infertility, because the spermatogenesis has to occur at a temperature lesser than our body temperature. That's why God has made it that the testes are descended in scrotum where there is a cooler temperature, so that the sperms are formed properly there. So whenever there is overheating of testicles, like as in it's like an occupational hazard. Whenever you see uh, uh, patients working in near heat furnaces, they are cooks by profession, or they are in coal mines, wherever there is constant heat and our work is near that, because of the overheating of testicles, we find a lot of defects in spermatogenesis. Another thing in our MNCs, how we can relate to it is, if you're constantly working with the laptop on your lap because of the heating, especially the gaming laptops, which cause more of when you're doing all this gaming laptop with all the work in that, it causes more heating than a normal laptop. So whenever these laptops are kept in the lab and we casually work around, it is indirectly causing overheating of your testicles and actually hampering the quality of your spermatogenesis. So many of us are unaware of it and we do it, and then we go on till it becomes irreversible. So these are small things which I wanted to tell actually, like overheating of testicles. There's something called varicocele. Then when we have ectopic testes, undescended testes, whenever we have trauma to the genitals, whenever we have infections which are not treated, like tuberculosis, gonorrhea, in ejaculation disorders like retrograde ejaculation, in mumps, or it can be the in male infertility can be because of purely genetic causes like Klinefelter syndrome. Can I have next slide? Yes, hormonal disorders like Kalman syndrome, whenever the male has hyperprolactinemia, in uncontrolled hypothyroidism also, in uncontrolled diabetes also, we have some infertility related. Whenever we have surgical trauma, whenever they undergo inguinal hernia, bilateral inguinal hernia, which is affecting the thing, so indirectly it also contributes in our infertility, and few drugs also are known to cause infertility. This is in males. Now coming to the female section, infertility, as we all know, I think we are more aware of the female part rather than the male part. The
True,
first and most important is the ovulation disorders, where we have premature ovarian failure. This is something, this is also what I wanted to stress on. This is also something with rising incidence right now. Previously, we used to not see so many premature ovarian failures, but now of late, we are seeing many premature ovarian failure. What is a premature ovarian failure? Your ovaries start to fail. That happens when you're nearing menopause. So all of us are born with some eggs, and God has given us some eggs at birth, on approximately 300 at birth, and we use one or two eggs or few eggs, couple of eggs every month in our menses, and then finally when we are done with our share, when our store gets exhausted, we get our menopause. So that is ovarian failure. That is a menopause which is happening on time, but that usually happens after 40. So 45, 50 is an age where I'll expect menopause. But if the same menopause is happening at 35, I have seen young girls at 24, 25 with premature ovarian failure, where their AMH is ovarian reserve, where their AMH is coming less than 0.1. So premature ovarian failure is where your eggs are getting exhausted much before their designed time or designated time. So premature ovarian failure is the most common. So, second thing is PCO, which has become so rampant in our society that at least 7 out of 10 people coming to OPD come with polycystic syndrome. PCOS. Polycystic ovarian syndrome.
Okay, what is it?
Polycystic ovarian syndrome is actually it is a syndrome in which you have the male and the female hormone, the balance is lost, because of which you have more of in the balance you have more of androgens, you have more of male kind of hormones, so they start predominating. Your menses becomes very irregular, the amount of bleeding becomes very less, the quality of your egg, the ovum what we talk about, becomes very poor. So they have difficulty in having a regular period, they have a difficulty in conceiving. Even after conceiving, there is a very high chance of abortions in such cases. So PCO is a completely a syndrome of hyperandrogenism. Means androgen is a male hormone. So we as females should not have hyperandrogenism. So all hirsutism, extra facial hair which you see, more of upper lip and lower lip. Yes. So the hirsutism, hyperandrogenism, delayed periods, difficulty in conception, all these form a syndrome which is called polycystic ovarian syndrome, which is PCOD in our common language, which people talk.
Usually we use that PCOD.
Yes. So it is nothing but basically it is ovulation disorder. I am not having a good egg and that is not getting released. So because of anovulation, I'm not able to conceive.
Okay. Generally why it happens, ma? Like PCOD or this kind?
It is multifactorial actually. There is not a single factor which I can say no. Like how diabetes is also multifactorial. It also is genetic and familial. Also our lifestyle disorders. Same way, PCO also is mainly our lifestyle disorders. We are having such a sedentary lifestyle. Now all of us are on the obese side. Whenever we come to our BMI, the very few section of the people comes on normal BMI side. So because of increased obesity, because wherever there is fat in your body, there is more male hormone synthesis. So your female and male hormone balance is out. So because of obesity, sedentary lifestyle, the kind of food we are eating, the junk food, and we are more towards unhealthy food in our diet compared to the healthy diet which we should be taking. All this along with the disposition, the genetic disposition, finally are causing more incidence of PCO now. So right now, I think in infertility female, it is almost ranking the topmost. So many people come down with PCO. So if you don't change your lifestyle, you cannot get out of this web. So the next thing is hyperprolactinemia. That is also a kind of hormone. The poor egg quality. And very rarely you can have congenital defects of vaginal tract. Congenital defects is where we are born with it. So it's not something which is acquired. There are many infections, and TB is India is endemic to TB. So genital TB it's there in way more people than we imagine. And then only when you start searching for it, you understand that yes, she is having genital tuberculosis, and because of which her fallopian tubes are blocked, and she's not conceiving.
How do they know, ma'am? How do they know?
That is the problem. Usually they can have just pain abdomen which they are just ignoring. They can have white discharge which they are ignoring. They might just think it is a small thing, and then slowly it increases, and they usually land up to hospital with infertility complaint. That's all, with no other complaints. When we start investigating for infertility in the infertility panel, we realize that hormones are fine, ultrasound is okay, but both the fallopian tubes are blocked.
Okay.
So the fallopian tube is it's the door. It's like kind of the way. If the fallopian tube is blocked, the sperm cannot approach the egg. So if it cannot approach the egg, there is no fertilization. If there's no fertilization, there's no baby. So the main gate, it's like a gateway. So if that is blocked with bilateral tubal block, they cannot conceive naturally. And then we go back and do endometrial biopsy for TB testing, and then it comes positive.
Whatever is the closed thing, is there any treatment for that fallopian tube?
Usually the fallopian tubes are like, very small cylindrical structures with cilia inside. Cilia is something like you have on your toothbrush, the bristles on your toothbrush.
Yes.
So they have a function. They are just not anatomical. They have a function, and they just sweep the ova towards the uterus. So when a tube gets blocked, or when there is any other infection, when there is TB, not only it is an anatomical block, the function of the tube is also lost. Cilia are also lost. The function of the cilia are lost. So even if I try and open it, it is practically not worth it. So whenever we have a bilateral tube, bilateral is both sides blocked. If I have a single tube block, yes, I can still conceive from the opposite side. Okay. But if I have a bilateral tubal block, both my tubes are closed. So there's no way the sperm is going to come and fertilize the egg. Then our next option is only ART. ART is assisted reproductive techniques, in which you have all this IVF and all. That is a whole chapter in itself. So we cannot conceive naturally if we are losing our fallopian tubes. So whenever you have small infections, you have white discharge or some vague lower abdominal pain, or you have any contacts with anyone of tuberculosis in your house, like your mother had, your father had, your sister had, and you have had close contact, or you yourself had TB previously, like you had previously pulmonary tuberculosis, like it was a lung TB. It was not genital TB. But in such situations, you have to prior go to hospital and get yourself evaluated whether are my tubes all right? Are they patent? Because I am at high risk, because I am a close contact to a person who has had TB in my house. So at least the high risk factors we should be able to identify, and we should know when to contact the doctor. So in infections, many infections are there, chlamydia, gonorrhea and all, of which TB is the most notorious to close your fallopian tubes. Okay. So these are the tubal factors we are talking about. Can we have the next slide, please?
Ma'am, one question. Which test will reveal this TB? Like, how do they know? And which test will reveal that she is suffering with the TB or TB?
You can detect the organism in tissue itself. So it's not something which I can go simply and get a blood test done and it's going to show that I have TB. If I suspect genital tuberculosis, that means there is some TB in my endometrium. Endometrium is the lining of the uterus. So I have to send an endometrial biopsy to identify the TB in that.
Okay, if the person is not conceiving only, then she has to undergo all these tests.
Female all these tests. Yes.
Done.
So other uterine causes can be hypoplastic uterus, Asherman syndrome. Asherman syndrome is caused by repeated DNCs when you go for abortions. Another thing what I want to highlight here is now this is a very now our generation is very career oriented. We don't want to conceive till we have reached a level of professional stability. In the meanwhile, if you don't take proper contraception and all, they end up getting pregnant and having multiple abortions, and they don't realize the danger it causes. Repeated abortions with DNCs cause Asherman syndrome. Asherman syndrome is something where your uterus is continuously where you have done multiple DNCs, you are curating it out. Curating is just like scraping it out. So every time you're scraping, the good lining of the uterus goes, and then it starts just sticking to each other, the upper surface and the lower surface, what we call the anterior and posterior. So what happens? The uterus, which should have been at a gap, it just sticks to each other at different places. In Asherman syndrome also, without releasing all those adhesions, getting pregnant becomes very difficult. So, they're not aware that repeated abortions with repeated DNCs, which are dilatation and curettage, can cause Asherman syndrome, which can actually affect their future fertility.
Okay.
So, that is one important thing. Another, fibroids, endometriosis, if you're using any drugs or if you're any cancer medication, which is chemotherapy and radiation also, can be a factor for your infertility.
Ma'am,
Next
drugs
slide.
which you were specifying, especially nowadays, young generation is using drugs. What kind of drugs? Like for the stress, for anxiety?
Yes. Usually, in
Usually,
all the drugs, I would like to highlight one thing, where now everyone is going to gym, they want to build their muscles, so they are taking all external hormones. These are the ones which actually not only damage your kidney, they damage all your organs to some extent or the other. So especially in males, and I have actually noted it down, we'll see it in our further slides.
yes.
In males, using all these external things are causing more problems, these androgens. Other than that, you can have all these cancer drugs, as we told, and antipsychotics, like how we have antidepressants. All these to an extent do affect your uh, fertility. Now, what are the now coming to our main thing? What I wanted to tell is, what are our lifestyle factors which actually influence our fertility and infertility? First thing, and the most important thing, is body weight. And all of us know that you have to maintain your BMI in a normal range, which is less than 25. So you should not be obese, you should not be underweight. If you're obese, it disrupts your hormones, it disrupts your ovulation. This is seen in PCO. And in males, it reduces the testosterone levels and it also decreases the sperm quality. When you're very much underweight, if you're less than BMI 18, like around maybe a weight of 30, 35, there you will have irregular periods and your ovulation will not be regular. So being underweight is also a problem. Being obese is also a problem. So what do? We are trying to maintain BMI in a normal range, which is between 18.5 to 24.9. Aim for gradual weight management. See, I'm stressing on the point gradual. Nothing should be so drastic that it affects your health. And it should also be consistent. There is no point if I lose 5 kgs now in 1 month and then I'm gaining it back in the next 2 months. So it should be a gradual, consistent weight management through diet and exercise. Can we have the next slide? So ideally, you should have a ideal body weight. Next comes our diet and nutrition. Now, there are few things that I have tried to you definitely you need a balanced diet, you need everything, but there are 5 things to stress upon in your diet which are required for your fertility. The first thing I think most of us know is folic acid. It was very common. You know that even before you conceive, when you're trying to conceive, when you're planning to conceive itself, you have to start your folic acid supplementation. It's not that I get pregnant, I go to a doctor and then start. The best way to start it is, when I'm planning to conceive, I start with 1 tablet of folic acid every day, so that the baby which is born has no neural tube abnormalities, neural tube defects. The CNS, the central nervous system, should be formed well. Otherwise, there are multiple issues with folic acid deficiency. So folic acid is one thing which is very important. Second, iron. Many of us don't know iron supports ovulation. Zinc supports sperm production. Omega-3 fatty acids.
Sorry to interrupt you, this folic acid and iron medicines, when they need to start from third month itself, or?
Iron we usually start after the first trimester. So that means first 3 months we don't give iron and we start off from the next, as soon as we start our second trimester, the fourth month. But
Okay.
then folic acid should be started pre-conceptionally. Preconception. That's what I said. No, when we are planning to conceive itself, we start folic acid. That is the best way to utilize it.
Okay.
And then coming back to omega-3 fatty acids, it improves the reproductive function. Vitamin D supports hormonal balance. Vitamin D is one thing which I feel almost 90% of Indians, I feel, at least in OPD when I see, they're deficient in vitamin D and they're totally unaware of it. Because vitamin D deficiency doesn't cause major symptoms. It causes body aches, myalgias, joint pains. All the symptoms are vague, and one of it is infertility also. Usually according to the Indian standard of sunlight, the sunlight which we get, we say, because India is a tropical country, we are supposed to have good sunlight, so our vitamin D level should be more than 40 for the kind of sunlight we have. But what I see, I am very disheartened to say that most of the vitamin D levels which come in our OPD are 2, 4, 10, 15. It is way beyond acceptable limits. Because we don't realize, as I said, we are getting more sedentary now. We are not going out. No one is actually. We are more in the virtual side now. Even the games we play are on our laptop. We don't want to go outside and play. We are
Yeah,
hardly getting any sunlight, and we are all living in flats with no direct sunlight access to anything, and we are
yeah.
living in ACs. So the kind of lifestyle we have made, we are actually the entire lifestyle is causing more vitamin D deficiency. Indirectly, it is causing infertility. So, we have this Mediterranean diet is usually associated with better fertility, and all these five things which I have listed, they're seen in fruits and vegetables, whole grains, nuts, seeds. In fish, you have more omega-3 fatty acids, legumes. All this you can see. So try to incorporate all these things in your diet if you want to have a good fertility index. Can we have the next slide? Next, physical activity, as we already discussed, moderate exercise improves the hormonal imbalance and the weight control, whereas excessive, intense exercise suppresses ovulation. Sedentary lifestyle causes obesity and hormonal imbalance. Next, smoking. Yes, we have seen now this is increasing trend. Previously, we had only smoking. Now we have e-cigarettes, we have hookah. All these are somewhere related to each other, and all of them are equally contributing to infertility. Many of us feel that we are not smoking cigarette. E-cigarette is more safe. In fact, it is more toxic. Hookah, they don't treat it as smoking itself. So these are all misconceptions which are indirectly causing major harm to our fertility index. So in
I know
females,
everything will be added into this.
yes. So in females, you have reduced egg quality. You have premature menopause. We discussed, no? So premature menopause. Then we have lower sperm counts in males, increased abnormal. So the sperms are fine, but they are all morphologically abnormal. Morphology means there is some defect in the head, there is a defect in the neck, defects in the tails. So though the count can be normal, but the entire morphology can be abnormal. So if a sperm is of abnormal morphology, it is of no use to me at all. And also smoking causes increased abortions. And here we don't see in pregnant women in India, but in abroad you usually see. Next, alcohol. Alcohol also disrupts your hormonal levels and your sperm production. Stress. This is, I think, none of us can deny that I am living a stress-free life. Everyone has stress of some degree in their lives. So this chronic stress affects your HPO axis. HPO axis means it is a hypothalamo pituitary ovarian axis. So what happens? Your brain actually signals, the hypothalamus in your brain signals your pituitary. The pituitary in your brain signals your ovary to make hormones. So there is a hierarchy in your body also, like how you have in your offices. But this axis is lost. This axis gets abnormal. when you have chronic stress, and therefore this axis which controls the reproductive hormone, the balance is lost. So stress also causes irregular ovulation, decreased libido, you have erectile dysfunction. So how do you deal with it? Try to go for more of medication, yoga, deep breathing. Try to find out what is that which causes stress and try to at least minimize those triggers.
Ma'am, which you have mentioned, chronic stress. I don't know. There are many sessions, many YouTube videos people are undergoing only for 1 or 2 days.
Yes.
I don't know. Like, is there any possibility to decrease the stress? Do you have any more suggestions?
Maybe
Like what?
if I tell that, I may sound a little maybe you might not agree with me, but I feel the stress starts because we are over ambitious. I want to do this, I want to do that, I want to do that, I want to do everything, everything of everything, which makes me just not do any one thing also properly. So because of your deadlines, because you have unfinished tasks, your ambition is as high. Maybe I feel it is unnecessary. You can have a relaxed life, you can have a calm soothing life when you're, I'm not saying it's wrong to be ambitious, definitely I will say be ambitious, go up in life, but then there are in ambitions also I feel we should be reasonable. It should not be to such an extent that it is going to damage my health. Then what is the use if I'm earning so much money if I'm going to go and pay it in hospital bills?
You, ma'am, you already have mentioned that, like age affects like
Yes.
some kind of.
Advancing age. Yes.
What do you suggest? People who are planning, like most of these nowadays, it is about 30 to 40 age.
Late marriages, late conceptions.
What is the
That's
best?
what I said. And that's what I'm trying to say. Now we want to be financially stable. I need to be this before I get married. Before I have, even after marriage, people wait. Okay, I want to be more financially better to be able to give a better quality of life to my child. But in the meanwhile, you don't understand that your biological clock is also ticking. Your body is not going to wait. I'm not going to be 18-year-old till I always. Definitely, in the meanwhile, it takes time for me to go where I want to go in my ambition.
Yeah.
So I feel you should not respect only your work. You should also respect your body and its biological clock. Whatever is possible, simultaneously, you can make it work.
Yeah.
So
Yes, ma'am.
as of now, it has been very, late marriages have become the norm, late conceptions have become the norm. And now it's almost normal for me to have a 35-year-old getting married now and coming. And I'm like, what? Our best time of fertility was from 20 to 35. In a golden period of 15 years, we were only working for our career. I'm not going to get younger now, obviously. Now I will have to work with that old, lesser quality egg that I have, which can cause multiple genetic disorders, abortions, the whole list of things is there. And then finally we say infertility ho raha hai, then we go for IVF. This is all because of our own choices, which can be easily controlled if you have a work life balance. In that also try to have your biological body also
Support.
included in that. Yes.
Ma'am, I have a question. Like, how long a couple can naturally try before starting this IVF treatment?
No, you don't actually need to go to IVF directly. As I told you, within 1 year, 80% of couples conceive. If your age is 20, 25, there is no need to even come to a doctor till 1 year. You can try till 1 year, you can wait. If you have no other medical disorders, if you both are young, there is no upper age limit, If you are well below 30 with no other medical conditions, you wait for a year, you try naturally. Still, if you are not able to conceive within the first year, then it's time for you to meet the doctor and get evaluated. Sometimes very minor things can be the reason. Everything need not be so major to land up in IVF. It can be just a simple uncontrolled hypothyroidism. You're not aware of it. It can be a simple mild PCO. It can just, with your lifestyle modification and with decrease of your weight, can get corrected. So everything need not just be infertility. Doesn't mean IVF. IVF happens in only 10 to 20% of the cases.
Yes.
70-80% conceive with some help from medicines, from drugs like tablets, injections. Only a few where there is a major issue, then only we have to go for IVF. No, but if your age is above 35 years, if you are 38, you have got married, then within 6 months, if you are not conceiving spontaneously, you have to meet the doctor. So if you are having medical conditions and if you are having a higher age, your cutoff is 6 months.
6 months.
Yes. If you are young, if no other medical disorders, 12 months.
Okay, great. Ma'am, usually in society, women are blamed for infertility. Like, what is your opinion? As a doctor, you are seeing many patients. I don't
Yes.
name it as patients. You see many women
Yes.
coming to you.
Yes.
More
Yes.
than one woman coming to you, and they are blamed even at home. Whoever in the home, in-laws or parents, whoever, they blame just women. What is your opinion?
The fact is, if there is 100 cases of infertility, 30% of the cases are because of female infertility, female factor. 30% of cases are because of male factor. 30% are unexplained, or it can be both.
Okay. What is
Where
unexplained, ma'am?
unexplained is when everything is fine. Apparently, everything looks fine. Your
Okay.
egg is fine, you're ovulating, your sperm is fine. Most probably, there are many other things which science has yet to discover. Some immunological factors, or maybe the quality of your egg was not that good. The quality of your sperm, immunological factors which are still not studied. So, otherwise, and also both factors, both male and female factor are there. So, what people don't understand is in that 100% of cases, 30% of cases alone are because of male factor.
Because of?
And people, male factor.
Okay.
And when they come to OPD, any gynecologist, when an infertility couple comes, when an infertile couple comes, or subfertile, I should say, not infertile, when a subfertile couple comes, we always try to educate it that it is as important to get the husband test also done as it is important for a wife.
True.
And the mother-in-law comes, she says, "Nahi, nahi, kuch nahi hai. Pehle iska treatment karo." I don't even know what is the problem. Then मैं सिर्फ women का ही treatment क्यों करूं? We always try to educate in our OPD that it is always 1 plus 1 is equal to 2. You have to get both of them evaluated, and then whatever is the problem, you get it. Most of the times they're not even ready to get evaluated. Leave about accepting that it can be a male issue.
Okay.
Somehow,
Somehow,
some male ego, or somehow the society we have built, there is no acceptance for female infertility.
correct, ma'am. Like, will you give any counseling kind of session for both the couples? For the
Yes, we
couples
do.
when they come?
Every visit when they
Mhm.
come for subfertile is a counseling for both of them. We try to evaluate where is the issue. We try to evaluate many things. Is it the ovulation? Is it the sperm? Or is it the technique of doing? Whatever is the issue, we try to sort it, and we try to get things right.
Okay.
So it is always a joint effort, and that's why always I say, whenever we have such counselings, patients should not come with their mothers, they should not come with their mother-in-laws,
What
they
else?
should come with their partners to hospital.
Yeah, partners, they don't approach you, I guess. Most of the female women, they'll approach you only with her mother. They don't even dare to come with a partner. They see
Yes.
that there is a fault of ourselves.
Yes. this thing of the society has to change. There has to be an acceptance. It is nothing like that. As you also got COVID, I also got COVID during the COVID era. It did not differentiate between a male and a female. So this is not fair to corner a female alone.
Great, great, ma'am.
It is
Yes,
a joint thing, and we
yeah.
should get evaluated together.
Correct, correct. Yes,
Yeah.
ma'am. We'll proceed. We'll proceed.
Can we have the next slide, please?
Yes, ma'am.
Sleep patterns. This is also a part of our stress. Minimum of 7 to 8 hours of sleep is required. Otherwise, our melatonin, our cortisol, all these hormones, if they are getting disrupted, they disrupt our reproductive hormones also.
Yeah.
Next. Environmental and occupational exposure. Now we are having heavily infected organic is very less, though the awareness has started to come, but then all our fruits and vegetables are all pesticides. These are all indirectly causing and contributing to our infertility now. So a lot of pesticides use, heavy metals, radiation, excessive heat to testicles, all this can damage eggs and sperms. Caffeine, moderate intake is acceptable, which is around 1 to 2 cups of coffee. But then higher intake of caffeine can slightly reduce fertility. That's one more thing. So when do you want to seek for medical help? Is when woman, as I told you, less than 35 years after 1 year of trying, or a woman who is more than 35 after 6 months of trying. If you have irregular periods, if you have absent menses, if you know that you have endometritis, endometriosis, PID is pelvic inflammatory disease. It's a kind of infection of your genital tract. Or if you have had any previous reproductive surgeries, like previously I had some surgeries on my ovary. Previously I had an ovarian cyst. So maybe my AMH might be little decreased. My ovarian reserve might have come down because of the previous surgery. So if you have had any previous surgeries also, you should seek medical help early. And if you
Ma'am,
have...
is there any chance for the person who is already having ovarian cyst or that kind of thing? Like they need to go for infertility treatment?
No. You seek medical help if you're not able to conceive within 6 months and you know that you have had these things.
Okay.
Not necessary that every ovarian cyst has to go for infant. Definitely no.
Okay.
And then history of recurrent miscarriages, male infertility, chronic conditions, as I told you, uncontrolled DM is diabetes mellitus, uncontrolled diabetes, uncontrolled thyroid also cause. So
they need to seek medical.
Yes. So this is what I thought. As we were talking about drugs and medication use, the first thing which is coming is anabolic steroids. Anabolic steroids are these which we use when we go for gym to build our body, to have faster results. This is what is very commonly used in guys. And there are so many young boys who come on dialysis because their kidney has failed because they use all these anabolic steroids. Also, they are directly causing they're reducing their fertility potential. So chemotherapy, antidepressants.
Right, ma'am. Yes, ma'am. Any more suggestions from your side? Like what do you want to give to the young couple who are just married?
There is no hurry. There is no race to get pregnant. You can give yourself time. You can, if you are healthy, have a good lifestyle, improve your lifestyle. My only point was to bring awareness on small things which cause infertility, so that the small things, if you change, if I have a less stress free, if I have a good sleep, if I'm consciously avoiding junk food, it may not be that I'm totally leaving it, I'm totally foregoing it, but at least I'm restricting it to maybe a once in a week. And I'm more trying to have more healthy diet. I'm trying to have a better BMI. I'm trying to improve my weight. When I start taking care of myself, then as a couple, you will definitely succeed. You should also know that when you have I have had few cases where we were they were getting treated for ovulation induction. Everything was coming fine. The egg was getting released. The sperm was normal. Repeated induction. She's not getting conceived. So I said, okay, we take a break. We take a break of 2 months and then we come back again. And in the next 2 months, when she's not on any drug, she has conceived naturally.
Oh, great.
Because what I'm trying to show is, it is not that, it is that she's so anxious, the mental stress, the trauma that they are taking. They feel that it is an exam. Yes, my period has come. I have to conceive in this cycle. Otherwise, if my period comes again, my mother-in-law is going to shout at me. So if you are under so much stress, even your biology also gets affected. Your reproductive capacity also comes down. So what I feel is, it is not a rat race to get pregnant. Give yourself time. Mentally, you be free. Definitely, nature will have its way. If you're healthy, there's nothing to worry about it. Yes, but then if you have issues, you should seek medical care early. Because, like how we say, time is money, time is also fertility. So as my age is advancing, my time is advancing, my success rate also starts coming down. So when you have health issues, please approach the hospital quickly with whatever problems you have. And don't take unnecessary stress in getting pregnant.
Ma'am, we have a question here. One of the participants is asking, what are the various treatments for infertility and what is your success rate on this?
Infertility is a very vast topic. We cannot say what are the various treatment. It all depends on what you have. Like suppose if I'm having male infertility, where I'm having less sperm count, then I will go back and check how are the hormone levels of the male, and why, if there is any hormone level, then how it is less, why it is less. Then I will try to correct the hormone levels. If I am seeing that he is a chronic smoker, and that's why the morphology of sperms are very low, the count is very low, first we will cut down on his smoking, and then we will give some antioxidants, we'll give some medicines to get it better.
Yes.
If I am having any infections, which I'm very clearly saying, then first I'll get them treated. If I'm having varicocele, like how in testis we have, then I will undergo surgery for that, and then I will plan for treatment. The same wise in a female, when I am having uncontrolled PCOD, which is causing anovulation, first I will try to go and correct the underlying condition which is causing it.
Okay.
So if the hormone level is abnormal, I will try to correct it. If the thyroid is high, I will try to correct that. And if she's obese, and I will try to improve her lifestyle modification first. So the most basic thing, this is just like a jigsaw puzzle. You know what is wrong, you sort that out, then things get better. Yes, where you have major issues, like I don't have, like premature ovarian failure, where there are no eggs left, or then my eggs are of such a poor quality that it is of no use, I have to go for a donor egg, my own eggs, or my own. Otherwise, I have azoospermia. I don't have any sperms. My sperm count is 0. So I cannot conceive naturally whatever I do. At that time, we take the help of assisted reproductive techniques, where you have so many. We can go for IUIs, then intrauterine insemination. We have IVF, which is in vitro fertilization. In IVF, we have ICSIs. Then we have we have donor. If I don't have any sperm, then I can take a donor sperm. And even if there is some issue that I cannot carry my baby, there is surrogacy. So whatever is your problem, then you have a solution tailored to that.
Ma'am, will be there any risk or side effects in these treatments?
Yes, even a paracetamol tablet you take has a side effect.
Correct.
You are unaware of it. That's it. You have paracetamol poisoning also. It damages your liver when taken in large amounts. So there is no drug in this world which you can say there are no side effects.
Okay, there are side effects.
Definitely. The best way is to, that's what I'm saying. The best way is not that, the best way is to have a better lifestyle so that we don't need them. And if we need them, then we have to opt for a good medical care where we are not just taking tablets by ourselves. I've seen people prescribing for themselves. years and years and years. I mean, they go to one doctor, they say 2-3 months treatment, then they jump to another doctor. The previous doctor will not know that this patient has already taken these tablets. That doctor will again start the same thing. So now indirectly they are taking the same thing to such extremes because of their ignorance, or they don't want to accept that yes, the next thing I have to go forward for my next step. So when the patient tries to treat by themselves, or when they go for all these Google treatments, which I totally disagree. And for everything, the Google will say ultimately you have cancer, and then they will come back to me and then say, "मैंने Google किया, ये है," and then it becomes very difficult to tell that patient you don't have carcinoma, you don't have cancer, you're totally fine. This is simply an infection. So some way, actually, we also have to take proper professional help so that we are not landing into all these side effects. If it is taken properly, if we are following the protocols, we don't have major side effects. If you are not following the protocols and if you're going for self treatments, multiple treatments, yes, there's definitely you can have.
Okay. Ma'am, this infertility, will it cost more? Is that expensive?
Yes. If you're going, compared to a normal this thing, when you're going for IVF, when you're going for higher things, then definitely they're expensive. Otherwise, your routine things just cause your OPD fees. That's all. They don't cause anything much.
Okay. Do people come to you like those, even in nowadays, we are getting maternity insurance policies, and also for IVF, we have policies. Like, did you come across any of these kind of couple who are coming to you who is already holding policies of IVF? Who can cover IVF?
Actually, in the center I work in, we do have till IUIs. We are not doing IVFs directly, and most of the insurances cases I have dealt have not had an infertility cover to them.
Okay. Okay, ma'am. With this presentation, I would like to tell you one thing for all the viewers and the participants. We do have this infertility treatment. Insurance is covered. Few insurances will be covered. Even IVF also.
Okay.
What do you call assisted reproductive thing, whatever it is covered in insurance. But only few insurance companies is allowed. Not every insurer will cover this thing. This I wanted to tell you. And if you come across any kind of such situations, do let us know, ma'am. We can help you on that.
Sure.
And I just want to conclude whatever you said. I just want to repeat it once again, ma'am, for participants. You told take less, don't take too stress, and your sleep pattern. Take care of the sleep pattern. Early marriage is good. Active lifestyle. No race to get pregnant. Less social stress. This is what we understood. Is there anything that you want to add and give it to our participants? A last takeaway from your end.
Take help whenever required. The last.
Definitely, ma'am. Definitely, and we'll be sharing your contact details and the address and everything to all the participants, those who are participated in this webinar. Thank you so much, ma'am. Thank you so much.
Thank you for giving me this opportunity, ma'am.
Even from our side also, you have given a time for us, even in these days, Ramzan season, all these. Thanks a lot, ma'am.
Thank you.
Okay.
Thank you.
Bye.
Bye.